So today I'm going to be administering Colace 100 milligrams orally for a client named Rose Valentine. Date of birth is January 12th, 1990. She's going to be in 22A and she has an she has allergies to penicillin according to her Mars. So I'm just going to go ahead and make sure I got the right medicine here. Colace 100 milligrams. All right. Everything checks out. So I'm going to go ahead and head into a room at 9 o'clock.
Come in.
Hello. My name is ACornejo. I'm going to be your student nurse for today. It is time for your medication order, but may I get a name and date of birth?
Rose Valentine at January 12th, 1990.
May I see your wristband? Alright, perfect. And then before we get started, do you have any allergies to any drugs or latex?
Penicillin.
Penicillin?
No latex.
No latex? You got it. And then, so, all your vital signs checked out. And then, are you feeling any pain?
Right here.
Right here? Okay. Gotcha.
Stomach.
Your stomach pain? Alright. And then, we're going to be giving you Colace 100 milligrams through the mouth. Is that okay?
What is that?
Colace is a stool softener, and some of the side effects can include a little bit more stomach pain, nausea, and diarrhea. Would you like to take it?
So it would help me poop more?
Yeah, it would help you poop better because
Oh.
it says right here that you are constipated.
Okay.
Are you still constipated?
Yeah.
Okay, perfect. So before I give you your medicine, do you mind? I guess you got to make sure that you can swallow correctly. So here is that cup of water. Gotcha. All right, everything checks out. So before I open this up, I'm gonna double check the Mars to see if this is Colace 100 milligrams. And then, all right, everything checks out. So I'm gonna open it up, and then I'm gonna fill up my water, and then just to make sure, may I get your name and date of birth?
Rose Valentine, January 12th, 1990.
All right, and then before giving this to you, I gotta just triple check to see if this is Colace, also known as Dacusat calcium. All right, everything checks out. Do you mind just? And here's that water for you.
Now?
Yeah. All right. Thank you so much. So I'm gonna go ahead and check back with you in 30 minutes. I'm gonna give you your call light, and I'm gonna lower down your bed or put up your bed rails, and then I'll be right back with you in 30 minutes. All right?
Oh, for sure. Thanks.
All right. And then when I am documenting this, I cross out the time, write down the time and administration, and then write my initials right next to it.
Come in.
Hello, my name is ACornejo. I'm going to be your student nurse for today. May I get a name and date of birth?
Rose Valentine, January 12th, 1990.
Cool, everything checks out. So 30 minutes ago, we did give you some Colace. Did it work out? Or did you feel any side effects?
Yeah, I was able to take a dump really, really good.
That's good. That's really good to hear. What about any side effects? Did you feel any?
A little cramping, but I feel like that did help push everything out.
That's good. That's good. So I'm gonna go ahead and give you your wound care. Is that okay?
Yeah.
All right. Let me go ahead and raise the bed and then wash my hands. Little roller coaster. It's okay. And then wash my hands. So before I put on some gloves, did you have any allergies?
I have a penicillin allergy.
Penicillin allergy? What about latex?
No.
No? Everything's okay?
Yeah.
Cool. So your vital signs were within range, you're breathing properly, your airway's clear, and how's your pain? Is everything okay since we gave you that pain medication?
Yeah, I think you're gonna be able to change my wound dressing without me nagging or being annoying.
Oh, you're not going to be nagging. I would be in pain too. It's okay. So I'm going to go ahead and expose your wound. Is that alright?
Yeah, go ahead.
Making sure I just expose the wound and the wound only. Covering up as much as I can for privacy. Perfect. Oh, let me go ahead and get this bag ready. My biohazard bag, put this right here. Alright, so I'm gonna go ahead and open this away from me. Throw that away. Grab the tweezers. And then, alright, we should be good. Gonna go ahead and use the pull push method on the skin to cause the least amount of harm. Alright, cool. So it looks like the drainage is serious sanguineous. That's good. That means you're healing properly. The odor is, there's no foul odor coming on. The color is good. And then the pressure injury seems to be healing. I see some granulating tissue. So let me see if I can find some more when I take these things, the old gauze off. Okay. I don't see any tunneling, which is good. The granulation tissue is there. There's no necrotic tissue in sight. There, throw that away. Cool. Yeah, everything looks good. I'm just gonna go ahead and measure that real quick. Grabbing this bad boy right here. Right. So, I'm gonna go ahead and measure this side first. There. It's gonna be coming out to 7 centimeters. This side is gonna be about 2 centimeters. And then the depth, I want to go to the deepest part of the wound.
Ooh, that tickles.
Oh, I'm sorry, I'll be a little more gentle. Alright, and then the deepest part of the wound was 4 centimeters. So everything looks fine. Throw that away. Now I'm going to go ahead and get my my irrigation ready. It's at a comfortable level. Alright. Gonna go ahead and take off my gloves. Wash my hands on the side. And then, right then.
You're doing good, sweetie.
Thank you, Miss Rose Valentine. Alright, now I'm gonna open this away from me. Oh, throw that away. Set this bad boy up. Open this irrigating stir water for irrigation, prescribed by your doctor. Pour some in here. Alright then. On this to the side. Alright, now I'm going to put a chuck right here underneath your wound to catch any of the water. Alright then. So put this underneath here to catch the drainage. And then I'm going to go ahead and...
Why don't you lower down my side rail so it's easier for you?
You're right, but let me go ahead and irrigate this first. So I'm going to start from the dirtiest, or from the cleanest to the dirtiest, so that'd be like right here. And then I would clean it until it is clear. So about right there. Throw that away. Make sure I cut all the drain. Next, throw this away. And then I'm going to go ahead and set up my sterile field. Sweet. So I'm going to wash my hands one more time. And then put on some gloves. Make sure. My goodness. On some new gloves to set up my sterile field. Alrighty. I can throw this away too, actually. Ow. That hurt. It's okay though. check right there. Alright, so I'm only gonna grab the end of my sterile field. Unwrap it. Alright. Make sure I put the shiny side down. 1, 2. Alright, so this would be the shiny side down right here. Alright, so then I would grab this, throw down my stuff, put some sterile solution in here for my gauze, and then I will take off my gloves so I can put on some sterile gloves. Write it in. Move that to the side. Here. Open this bad boy up best I can, only touching the edge, around the edge. And alright, use my non-dominant hand to put this one on. Hello. It's fine. Alright, I can fix that later. Yeah, I'll fix that later. Make sure I don't grab the top of the glove. Oh my goodness. Alright then. Go ahead and grab this. Now since this is sterile, I can actually fix my dumbness. There you go. And then now that this is sterile, I can finally fix this side. Oh, excuse me. Oh my goodness. There you go. Perfect. Okay, a little nervous right there, but keep cool, calm, and collected. That's what I'm talking about. Alright, perfect. So now that I am sterile, I can finally move my things around. That didn't touch that. You didn't see that. That wouldn't have happened. Alright, now that I have, I'm gonna put some of my gauze in here. Put some gauze in here. Alright, cool. Keep that gauze for the end. Okay, make sure everything is soaked in the sterile solution. Go ahead and rinse these bad boys out. Alright, go ahead and just leave that on top of there. We're gonna use the tweezers to make sure it gets all in there. And then once I put these in, we'll see if the one will need another more. And grab the tweezers. Place that in there. Go. Alright, yeah, that should be enough. Throw this away. Okay, now we'll grab these. 2 of them, I believe. So I can cover cover all the wound. There's 2 on there. And then I can go ahead and put that. So now I'll take off my sterile gloves. By the middle. I'm taking off my gloves sterilely. And then, boom, throw that in there. Alright, so I will now grab my tape. I will tape the sides in a window formation, and then on one of the tapes, I will write down the time and also my initials, and then I'm good to go ahead and cover you back up. Thank you so much for your patience, Miss Rose Valentine. And then from here on out, I will clean up my mess. I will lower down the bed rail. I'll make sure the call light is in reach in case you need anything else. Lower down the bed, call light, and then I'm just gonna clean up, and then that's it.